Is it possible to enlarge the penis without surgery? And if so, will this gain be permanent? Will it be possible to increase penile girth as well? The short answer is yes and no. Welcome to a video on penile traction devices. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist. Does traction work? The clear answer is yes. The body adapts to its demands. There is a lot of plasticity in human tissue. The human race has known about this for thousands of years. Just look at the tradition of stretching the neck in certain African tribes. A couple of years ago, urban tribes in megacities used to stretch their earlobes to grotesque dimensions. Haven't seen it in a while. I think it has gone out of fashion. Anyways, in medicine, traction therapy is established standard of care in plastic surgery, in orthopedics, and reconstructive surgery. What about the penis? Strangely enough, I have been at this point a couple of times in my videos. The penis is a taboo, also among doctors. Whenever there is a proven therapy somewhere in the body that could also be beneficial for the penis, there is that big silence. So concerning penile traction, the number of studies is rather low and not necessarily of premium scientific quality. However, having the aforementioned facts in mind, we can assume that traction also works for the penis. So when you stretch tissue long enough, the body kind of thinks, okay, that's the way I'm supposed to be. So it will start to mold the tissues to adapt to that force. The important thing is that this is not just a stretch. The result is real cell growth. The penis will enlarge indeed. If you would take a small sample out of that tissue and put it under the microscope, you would be able to see that effect. By the way, did you know that you can become a member of UroChannel? I just started memberships. Check out the perks and become a member today to support my work. Your membership helps to maintain the high quality of my content. Many hours of preparation go into each of my videos to bring you the most up-to-date scientific knowledge possible. So, what can you expect from stretching devices? 1.5 to 2 centimeters is a realistic outcome. This translates into 0.6 to 0.8 inches. The interesting thing is that this is within the same range you can expect from surgery where the suspensory ligament is divided. The good part is that there are only minimal side effects from stretching. 40% experience occasional pain, that's it. So stretching is relatively risk-free if you do it right. I'm going to tell you in a minute how to do it properly. But before that, here's an important message. Guys, stay realistic. According to research, many men expect gains in length of 5 centimeters on average. That's 2 inches. Even if you disassemble the penis and work with cartilage transplantation, the gain in length will only be 2 to 3 centimeters, which is 0.8 to 1.2 inches. If I were you, I would stay away from doctors and clinics promising you otherwise. That's dubious advertising. I'm not saying it's impossible to gain a little more than 3 centimeters, but for the majority of men, it won't happen. What about girth and stretching devices? Most likely, there is no gain. So this part will have to be achieved with fillers, fat, etc. There is only one small study that showed a minimal increase in girth. I would say, if you try traction, don't count on effects on girth. Now, that was the easy part. Here's the catch. Traction has to be performed meticulously every day for at least 2 hours, preferably 4 to 6 hours, over the course of 6 months. There are now second-generation traction devices on the market. I am not allowed to tell you their names. Laws and regulations for doctors in my country. However, with these new devices, it seems stretching times can be reduced a little. Overall, there is no gold standard when it comes to stretching devices. All products have their drawbacks. The simplest ones are also the least expensive. They cost something like $160. They are designed like a tray with elongation rods. The head of the penis is placed onto the tray and a silicone strap is used to tighten it. This works well in medium to large penises. Small penises have a tendency to slip out of the fixation. There are expanders where the glans of the penis is inside a suction bell. I like these. They seem to work with most men. But so far, I have seen one man developing a nasty blister on the glans. So it is important to interrupt the procedure every now and then, which is true for all expanders, by the way. There's a device where you have to put on a plastic tube onto the glans first. This tube is very rigid. It looks very easy to put it on in the promotion video, but trust me, it is not. Some of my patients failed at this step and couldn't use the device altogether. But even the mentioned second-generation device is a bit tricky. It requires that you wrap an adhesive tape around the glans first. Not all patients are happy with that solution. The penis is clamped like in a vice, which can hurt, and if you don't tighten it sufficiently, the penis may slip out. The more advanced devices cost something between $350 to $525 US. And not all devices are available anywhere. That second-generation expander is not available in Europe. I think they sell it in the US only. However, if you want to try stretching, you have to do it for the sufficient amount of time, and you have no option to skip days, like doing it 2 to 3 times a week. If you don't do it every day, you most likely will not see results, especially if you don't follow the protocol within the first 3 months. According to the data at hand, stretching takes 6 months. After that, most of the gain is accomplished. Any more lengthening beyond that interval will likely be minimal. Back to my video on vacuum pumps. Pumps haven't been able to show similar results, most probably because they can only be used for 20 minutes per day. That's too short to induce cell growth. One word on how to stretch. It should be done carefully. Start slow and progress slowly from month to month. Take a break of 20 minutes every 2 hours. What about weights? I've been asked this question many times in the past. In my opinion, free weights are a terrible thing, and I consider them being dangerous. I recently read a case report of a man who tore his cavernous bodies while attempting a horrifying lift with his penis. In my next video, I will talk about girth enhancement. Please have in mind that my content is not medical advice. If you experience health problems, make an appointment with your local urologist. Don't forget to subscribe and give the video a thumbs up. Thanks for watching. Bye-bye.